Washington State PTA stands united in support for the medical and mental health of all students P through 12 with innovative funding solutions for increased non-teaching staff, including but not limited to nurses, counselors, social workers, and psychologists in schools, provided by both in-person and telehealth access. To provide proper daily medical management and harm prevention, the National Association of School Nurses recommends the school nurse-to-student ratios you see here. But let's take a look at the ratios that are funded by the Washington State Prototypical School Funding Model. It funds one school nurse for every 6,250 high school students, one school nurse for every 7,200 middle school students, and one school nurse for every 5,263 elementary school students. Clearly, the medical needs of students are not being prioritized. So how about the mental health needs of our students? The American School Counselor Association recommends one school counselor for every 250 students. But take a look at the prototypical school funding model. Why would sufficient funding for school counselors at the middle and elementary school levels not be a state priority? Every stage of student development presents unique mental health challenges, from the initial development of social skills in preschool to important decisions about risk and opportunity in high school. Every child deserves equitable access to the guidance necessary for their individual success, which mental health professionals are uniquely trained to provide. So why so few school counselors relative to expert recommendations? Could other mental health professionals be making up for the lack of school counselors? How about school social workers? The National Association of Social Workers recommends one school social worker for every 250 students. At that ratio, the number of school social workers would help quite a bit. But unfortunately, the prototypical school funding model supports ratios which are dramatically insufficient. In fact, in this chart, you have to use a magnifying glass to see the students. The school psychologist story is even worse, where once again Washington State does not adhere to the national recommendation, with negligible funding for school psychologists. With these ratios, how exactly are schools managing student health? When a school is without a nurse, counselor, social worker, or psychologist, the need for health services does not go away. School districts and local school communities overwhelmingly agree that this is unacceptable. And so other sources of funding are used, which creates a severe equity issue, affording basic health needs disproportionately to those communities that are able to generate additional revenue. Without additional funding, school communities are forced to use staff who are not adequately trained to deliver health services. But this is not just an equity issue. Depriving children of basic health services is a severe public health issue, and the COVID-19 pandemic has made that even more clear. How can we consider in-person school without sufficient school nurses? How can we consider skimping on mental health professionals while our children endure the emotional difficulties of the pandemic? Back in 2011, Washington voters approved Initiative 1351, which requires increased funding to support stipulated staff-to-student target ratios. As an example, let's visit our school nurse ratios. You can see how the ratios would improve as required under Initiative 1351. There are similar improvements for mental health professionals, and voters expected this funding to be completed by the end of 2019. But in 2015, the legislature voted to delay it. In 2018, the legislature directed OSPI to convene a technical work group to review the stipulated ratios. The work group's recommendations reaffirmed what Washington voters said nearly 10 years ago. Staffing levels must be raised to meet student needs. In the 2020 supplemental budget, lawmakers added funding for additional counselors in high-poverty schools. But, out of fiscal prudence, the new investment was vetoed. School communities should not be forced to imagine how to keep children safe and healthy without adequate support from health professionals, and so state leaders need to think outside the box to carve out the solutions and the funds, because the need is increasing faster than ever. Please make additional investments to address our students' medical and mental health needs this budget cycle. Our students are counting on you.